Neck rejuvenation, tightening. What is the best procedure for this? Consultations have differed between a quick lift, a neck lift with jowls lifted, a skin-only neck lift, one with the muscles sewn together, and possible lipo. I don't think I need any fat removed. Chin scar is from a Mohs surgery and a lot of tissue removal. Therefore, it was suggested that I have lipo on the other side, where there is more jowling. I'd like the best results without a major face or neck lift. Suggest options? The names, Max, Smas, Mini, etc., are very confusing. Thank you.
Thank you for your question. You've submitted a single photo showing the lower part of your face and neck, and you stated in your question that you had a scar under your chin after having a Mohs surgery, and that you've gone through several consultations and you've been essentially overwhelmed by the different names and the terms relating to the best face and neck lift procedure for you, which results in, of course, confusion, and you're looking for some guidance. Well, I can certainly help you with this question. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Face and neck lifting surgery has been a significant part of my surgical practice over the many years I have been in practice. And I can certainly share with you many of the challenges there are in how people make these decisions and what the options are in front of them. So let's begin with just understanding what the essential problem is. And in the absence of a physical exam, there is still a certain limit to what recommendations can be provided. But the reality of face and neck lifting surgery has been kind of an evolution over the course of the past 20 to 30 years in what the outcomes will be and how to get the most longevity and do it in the safest way, in the most predictable way. Now, on top of that, I would also add that there is a really much greater awareness and understanding of facial aging that is not just the result of sagging. That also there's a greater understanding of the volume loss that is related to bone loss, muscle, fat, and soft tissue and skin. So I can tell you that in my own career, when I first was training in facial cosmetic surgery, for a surgeon, the goal was to lift as significantly as one can while maintaining a natural appearance and understanding that a certain amount of tissue elasticity would cause a certain degree of regression. And I think one of the things about being an experienced surgeon is that you understand that regardless of the technique, regardless of the name, regardless of the plane or the level and depth of the technique, there's a certain amount of relaxation that invariably occurs, and that there's a certain amount of tissue stretch, skin, soft tissue. And so it's very important to also understand that in the end, what has basically been an evolution in my own practice is that I do my procedures to get the maximum amount of lift with minimal surgical time, as well as quickest recovery for the patient. And I think that has essentially evolved a lot, not only just for myself, for many of my colleagues. And I've noted for myself how many of the people who are, let's say, a couple of decades older than I am, who I learned a lot from, kind of went from doing more aggressive surgeries to kind of coming back to what I see as very similar methods that I do. And so that we've kind of all arrived to a place where essentially we have to meet the needs of a modern person and understand that surgery is one part of the overall solution. So I would say that from the way I would approach a patient like yourself after physical examination and evaluation, I would say that I would do as appropriate, face and neck lifting surgery without any brand name or anything like that, under local anesthesia with light sedation, and that I would also communicate with you and understand that there are certain areas of the face that has volume loss that you just can't just lift aggressively enough to hide. So I would say there's a kind of twofold approach. You approach the lift to restore position of sagging tissue. You then do volume correction to restore volume loss. So I try to explain that now there's certainly ways to do that, but I would say that my goal with volume correction is to do things that are predictable, consistent, and are able to allow for minimal downtime. And so generally I show my patients that the area of like the jowl is a very important area to understand. When you lift the skin and you still see a notch or an indentation, people think that the jowl is still there. But no, it's called the mandibular notch, that area where the bone actually gets a little bit deep or resorbs. That's an area where a filler can be of benefit. When you look at the mid-face, the cheeks tend to be more hollow. So you don't just lift, but you restore volume. So there's an art. There's an art to doing this, and in your situation, a scenario where there's there's also a skin shortage to a degree after undergoing Mohs surgery, that also has to be factored in. Last but not least is also understanding the best way to improve skin texture, tone, and quality. That's not about lifting. That's where technologies such as the use of platelet-rich plasma, this is derived from your own blood, or other ways to help regenerate skin quality. So we're now differentiating skin quality from skin quantity. And then the use of possibly thermal energy devices and lasers. So essentially, I feel like in my own practice, what I help my patients understand and what I provide is a more comprehensive plan and solutions for the different elements of what a patient needs. So thinking in terms of overall philosophy, yes, face and neck lifting for repositioning, then volume correction to restore volume while volume is lost, and then improving skin texture, tone, and quality with the many tools we have for that. And so it is understandable that you have saturation and brand confusion, but when you understand these basic principles of reposition, revolumize, and then improve texture and quality of the skin, then you kind of understand the global strategy, and that one operation or one procedure is not the solution to all elements of facial aging. So I think that what you should do is meet with doctors, and you've already done that, but with this kind of approach, look for an approach that I feel, from my perspective, is going to be the safest for you, have the most predictable surgical result, and give you the recovery time so that you go back to your normal life as quickly as possible. I think gone are the days for most people who actually work and have many responsibilities where you can have a very long, prolonged, like 1 month plus recovery time. The modern world, even for my patients who I do face and neck lift surgery and lasers and other things, people need to get back to work. And so I would tell them, give yourself a week to 10 days, and depending on the extent of the face and neck lifting surgery I'm doing, so that you can get back to work and not draw attention. So I think that that's also a very, very important guiding principle, which is why some of these short scar and other procedures have come about. But at the same time, you still want the longevity and benefit of a good quality procedure. So again, think repositioning, volumizing, and then skin quality and texture improvement. So I hope that was helpful. I wish you the best of luck, and thank you for your question.